Yep, that looks great. Okay, we'll wait 1 minute to formally start. Uh, so for folks joining who weren't here before, the way we're doing this, and this is full disclosure, the first time we've run a Data Plus virtual poster session virtually, is the group's going to give a quick 5-minute overview of their poster, and then we want to sort of simulate a poster session as much as we can. So just jump in with questions, put them in the chat while they're talking, unmute yourself, and I'll facilitate if anything needs to be happening. But otherwise, people should just go ahead and ask questions. And then about 5 minutes till the next half hour, you can jump over to the next room. So yeah, go ahead and take it away, Group 16.
Okay, so thank you all for coming to listen. We are Group 16, and we have been working this summer on designing a prototype environmental health data dashboard for North Carolina. So the Centers for Disease Control and Prevention has a national environmental public health tracking network that has a goal to help to allow users to understand and visualize the connections between health data, environmental data, and population and demographic data. So this is a national program, but 26 different states, as well as New York City, also have their own programs, but North Carolina doesn't yet have one. So we've been working with one of the departments in the Division of Public Health in North Carolina to create the prototype so that they can actually apply for a grant to have a fully funded model. So the initial major goals of our project were to create this prototype or pilot data dashboard, to create a package of R scripts to document how we did our data processing and guide future developers in processing new data that comes in. So yeah, and to create a big metadata table that would guide kind of how the different measures in our data are defined, and Leah will talk more about what metadata means in a minute. But in terms of the types of data we have, like I said, we have environmental data in our dashboard, which is things like the average annual ambient PM 2.5 concentration or different toxin levels. And we have health data, which is things like hospitalizations, mortality, and emergency department visits. And then we also have population and demographics data, which includes things like education levels, socioeconomic status, and race ethnicity.
Yeah, so just to go over what our actual workflow and process looked like, as Anna just mentioned, there were three main aspects to the process. So the first was creating the metadata, which was basically deciding how all of the different data in our tool is going to be organized and structured. So we kind of came up with these broad categories of content areas, indicators, and measures, and then measure variants. And each measure variant is a specific way. It's a very specific measure of health or environment. So number of days over national number of days where ozone is above the national standard would be one example. So in the metadata table, every row is a different measure variant, and there is information such as descriptions of the measure, descriptions of the indicator, and these different descriptions are displayed in the tool to kind of add an educational aspect for anyone who's using the data dashboard to kind of explore. And then the second aspect is the data processing. So this was mostly done in RStudio. We created several scripts to process the raw data, and then we tried to clean the scripts so that they could be used in the future to update the tool annually as new data sets come in. And then finally, there's the actual dashboard design, which we did in Tableau. So the actual prototype is in the form of a Tableau story, and it has 6 different tabs. The first tab is a welcome page, and the other tabs all have different interactive dashboards that each display the data in with a certain focus. So there's a comparison page where you can select multiple places and see how they compare across measures. There's an overview map dashboard where you can see a map of North Carolina and then explore each county for a specific year. Yeah, so those are basically our three main aspects of the project.
Yeah, so we've pretty much accomplished all the initial goals that we set out to accomplish. And these past few weeks, we've been moving from trying to develop and keep on improving our dashboard to running it through some test case scenarios and creating a write-up document to help guide the people who pick up our work after this summer. So you can see it under analysis and limitations, there are two maps. These maps are both created through our map dashboard page. And the one on the left, I can't really read because the text is really small, but I believe the one on the left is asthma ED visits. And the one on the right is percent of population spending 30% or more of their income on housing. And this case study, the goal of this case study was to detect disparities in asthma emergency department visits around low income housing stock. And obviously the 30% measure wasn't a perfect representation of this, but it was kind of the best proxy measure we could come up with. And you can see that you can't, just by looking at the two maps side by side, you can't really see any correlations. And we think this is because of the lack of tract level and neighborhood level data that we have access to because of data privacy reasons and other just difficulties in gathering data. And going off of this, talking about some of the things that we weren't really able to get to this summer, we're hoping to create a vulnerability index specific to environmental health. So this would go on the county Zoom page and users could look at their county and see an index and get like a very general idea of how their county is doing based off of environmental health. And then another goal we had was to continue to perfect the language of our measure descriptions and to try to ensure that they're as readable for the general population as possible. And that can be kind of difficult with so much jargon in a lot of these measures. And then finally, to keep on acquiring data, as much data as we can, and at the most granular level that we can do it. So I don't know if our project managers or our project mentors are here, but I saw that our project manager, Melissa, is here. So shout out to Dr. Mike Dolan-Fliss, Dr. Kim Gates, and Melissa Minto for all their help over the summer. We really could not have done this project without them. So yeah.
So thank you all very much. It's phenomenal work this summer. And I think, I mean, we hope that all of our Data Plus projects have obvious social value, but I can't imagine more social value given all the different public health crises we're having right now than building tools to make people and governments have this data at their fingerprints. So fingertips, really great stuff. Yeah, Mike's here. Folks have questions? Go ahead and unmute yourself or put in the chat as you like. Let's see. So Felix Jang asks, what are some of the next steps you guys have as a group?
Felix, are you referring to us personally or like the group, the data dashboard group?
And actually, Courtney, maybe I'll shape that a little bit. Courtney asks, going off that, what steps are required for you to get more granular data? And Felix says the data dashboard group.
Yeah, so we've had a lot of conversations about the possibility of including community data, which is at an even more granular level often than the census tract, and come to the conclusion that that might be impossible just based on the standards that governments have for data that's allowed to be displayed publicly, and based on the fact that different communities can collect different amounts of data. But in terms of census tract level data, that has a lot to do with privacy laws that our team didn't actually discuss that much or learn that much about. But the hope is that since other states have been able to get data at the census tract level for many different measures, the hope is that that will be available in the future. But I will say some things like different demographic data at a very like granular geographic level has some privacy concerns associated with it, especially because census tracts are so small. So that, I think, to answer your question, it mostly has to do with navigating legal barriers, and some of it also has to do with just re-aggregating the data based on how it was initially collected.
Just adding to that real quickly, we actually do have some data that's sub-track level. I believe that after we finish, someone from the DPH is going to add some well water data that's actually sub-track level. And also, I think we have data from Clean Air Carolina, which is also kind of done at a community level. So.
Mike, you want to just unmute yourself and ask that question?
Sure. So this is Mike. Great job, team. It was really a pleasure to work with each of you individually and as a group this summer. So my question is, you all did a lot of interviews. You saw probably more public health data than most people see in a lifetime, even if you see ground level, road level data. But of your interviews and discussions that we had, you were a part of the data itself, the sort of framing, anything at all. What surprised you about your experience this summer versus what you expected going into it?
Going into it, I thought that we'd only be talking to public health experts, but quickly realized that there's so many people involved in just the public health field. Like, we talked to an attorney, and it was super interesting to hear from his perspective what he would want to see the dashboard look like. So just the variety of fields to talk to.
Yeah, for me, what surprised me the most, I just came into it like kind of like Paul said, like recognizing the inherent worth of a project like this and what it could do. But I had never until this summer have I thought so much about the limitations of data. One interesting conversation we had was that about the fact that like averages, which is pretty much what we're working with, averages really obscure facts about populations. And, things can be super different within a county and even within a census tract just right across neighborhood lines. So I definitely had never thought so much about, in some ways, the potential for harm, but also just the limitations of this type of project. And I definitely think that's something I'll take into the future, take with me into any future projects I do with this type of data.
Yeah, I think I agree with that one. Like just realizing partly the limitations of data, but also just like how much behind the scenes there is within like each data set. Like I did not really know what like, data cleaning or like data processing was going into this, but just like seeing the raw data and then realizing that even before that someone had to like collect it and like put it all online. Like when you just like think all the way back, so much goes into just having like a readable data set. So I definitely just appreciate like any graph that I see a lot more now.
I'll also add, as someone who did not think that I would go into anything quantitative, or I surprised myself when I decided to potentially study statistics, I thought that it would be very easy to keep in mind just how personal all of this data was and how much it really applies to individual people and affects people's lives and is not, people aren't just numbers, but as you're working with data, like I personally really got into like just the numbers and looking at the numbers. And so the fact that I forgot, how quickly, like how crazy it is to be working with like death data, for example, like the fact that I forgot that made me realize how important it is for data scientists and people who work with numbers that have to do with people to remind themselves frequently, like the true weight of the data they're working with.
Speaking for the math and stats department, we're very glad you did go into something quantitative. So,
yeah, thanks so much, team. That's great. I think one great thing about public health, and I was really glad that you got such a broad experience this summer, is that we can't do it. It takes a village. It really takes a village of lawyers and program managers and surveyors. I mean, there's not a profession that we don't need to be attached to public health. And that's really the only way, when I work with a lot of data that has a lot of heavy meanings, being able to work with that team so closely, such a broad team, is really, really a wonderful experience. And, there's a lot of meaningful sort of data play that it takes to get even these sort of heavy data sets out into the world. So if you want to take a break from the really heavy human stuff and just process the data, you can do that too. So really glad you all got such a broad experience. Thanks again for the help.
Anyone else have questions? Just go ahead and type in the chat or unmute and just talk.
Hi team, this is Kim. It's good to see you again, and this is a beautiful poster. I'm just curious, as going into this, usually when you have an internship, you're thinking about gathering information for your future career, and I'm just curious as to before versus now. Like how this might have changed what you think that you want to do in the future, or if it did.
I think for me, I've always had kind of a little interest in public health. But I think after this experience, I've realized just how much potential there is in the field. And I'm like pre-med, so my goal is to be a doctor eventually. But just thinking about like how much our healthcare system could be improved if we put more emphasis on public health. And I think now I'm definitely going to try to study and take more global health classes in college. So
I came into this thinking I wanted to go into public health of some sort, and I still think I do, but I think that I thought the avenue for that for me would be mostly like academics and like the route towards academia, or just like research at universities, I guess. And so now definitely like the whole option of maybe working for the government has been opened up for me, and I just really appreciated getting an inside look into kind of what all these different kinds of people do and what kinds of jobs are available. I had no idea that so many different types of public health related jobs were available at the state and the county level. So that was really interesting to learn about. I also now know that I don't want to work from home, so but that was a good thing to learn about myself.
Yeah, it's very unexpected.
Ditto. Yep.
I guess for me, I mean, I'm like very lost in terms of like what I'm majoring in slash like career futures. But yeah, I kind of came into this because I was interested in stats, but also environmental issues. And I think this kind of just gave me a much more concrete idea of like what the actual work could look like for, I guess, I guess just like doing data processing, data management, and then it was really helpful to me to talk to all the different interviews we had. That was really helpful to me just to understand like all the different sides of like how people engage with like the environment, but also like community members and public health. So it didn't really help me narrow down on anything, more just like expanded my awareness. But yeah, it was really, really helpful either way.
Yeah, that's great. I mean, I feel like my own career trajectory was kind of a process of elimination of what I didn't want to do. So don't feel bad if at this point you still don't have a really clear idea of where you want to end up, because you just never know. And Jerry, I would highly encourage you, even if you go into the medical field, it's really important to have physicians who understand public health, and also to have also medical doctors often end up working in public health as well as kind of the consulting for the more medical side. And it is two different ways of viewing the world, individual versus population based, but we really need both. Um, and Anna, yeah, I would just encourage you to keep looking at all the different aspects. And there are even more settings. There are contract research organizations that are kind of a mix of all of, you know, academia in a way, um, and government, because you can be a government contract research organization. So yeah, there are so many options out there, and it's hard to explore everything, but I think if you keep doing things like this, you'll eventually land in a place that you love. So I really hope that for all of you.
Yeah, actually, just to frame what Dr. Ged said, I think working myself at a contract research organization as well as being part of Duke, I think the Data Plus experience is probably not far from an introductory version of contract research, because you're not working for the client, as in they don't pay you and you don't continue there, but you're also not just writing papers. There's a thing you're supposed to do, and you have all these internal resources from the organization that help you deliver that. So this doesn't look that far from that. It's just that it gets harder and more interesting, hopefully. Yeah. So folks have questions. Also just want to flag that if you want to jump over to other rooms, that starts at 2:30, and those tend to start pretty promptly. But please ask more questions now if you like. So I'll ask one, which is, it seems like you're using a dizzying array of technical tools. Out of those tools, which ones did you have no idea how to use before you started? And how do you feel about them now?
Um, we all took a course on Tableau before the program, but I was doing a lot of the like dashboard design in Tableau. And that definitely like it was a lot more complicated than I was expecting. In that originally I was kind of just like you could like drag the whatever data into it, like it makes it very easy to make like a basic visualization. But when we tried to make those more complicated, it kind of took a lot to like figure out. So that was like kind of fun to figure out, and I feel like it's a nice skill to have.
Yeah, I was doing a lot of the data processing in R, and I had taken two stat classes at Duke, and So I kind of was comfortable with how certain features of R worked, but I don't think I ever wrapped my mind around like what it means for data to kind of like change forms and like be long form or wide form, or like how joins really worked, just because of the way we use R in stat classes is like to, you know, make models and stuff like that. So I definitely wrap my head around how to do like kind of data processing and cleaning in R a lot more, which I am hoping will be really useful in future coursework and just other work. So it was really fun to learn.
Cool.
I'll add that at the start, we kind of had a lot of difficulties with even using Git, and that was kind of fun to work through.
Yeah, I mean, I'll say as someone with the contract research company, one of the biggest obstacles when we hire math PhDs is they know a lot, and man, so many of them have literally no experience coding collaboratively. And so the more you learn those tools, the better for anything you want to do ever again. If nothing else, it'll stop your coworkers from shouting at you. So, or make them do it less. Any other questions folks have?
I have a question. I want to know which data set that you guys processed was most interesting or most surprising once you saw it, how it plot across the map.
One that immediately comes to mind is that that asthma emergency department visit data that's on the screen right there. I think the disparities and like just the distribution there is so apparent in that map on the left-hand side under analysis and limitations. And I think just in that vein, a lot of the health data in particular was just, it was pretty clear to see the disparities from county to county, and especially just different regions of North Carolina. And just, I don't know, growing up in a household that talks a lot about public health, I hear about these things, but seeing them in the data that I am working on processing is always like, just, I don't really know the word for it, but it always like takes me back how clear those trends that get talked about actually are in the data.
Either the other two team members have an answer to that one?
Oh, sorry. I can't really think of anyone specifically just because we only did a few of the case studies, but something interesting that I learned was that I was doing the case study on like climate change and looking for the extreme precipitation measures. And it seemed like some of the greatest threats were like along the western side of North Carolina, which I wasn't really expecting because I was kind of expecting more to be along the eastern side where I don't really know why, but I just learned that like there are a lot of different ways that like climate change will impact the state, like depending on like the geography, because I kind of assumed it would be more just like, oh, floods like along the eastern coast, but there's actually like a lot of a wide variety of threats. Kind of random, but
Yeah, Leah, I saw that in the report, and I don't know if you had a chance to read any of the comments, but because of the mountains and all the rivers up in the western part of the state, they often have really severe flooding whenever there's a flash flood, rain event, and often roads get washed out, and it can be really difficult for those remote areas where that's the only way into that community, or the only like easy way into that community.
Yeah, that's so interesting. I just didn't know that.